crazy. Like, I have to usually say like, no, it's okay if I don't move. I really want that. But like, what are the trends? Like, do you see any trends? I've tried threading once.
Yeah. I mean, I do threads. I do, there's a new product on the market called Daxxify, which is a neuromodulator that lasts 6 months. So that's exciting for patients. So we're just starting to use that pretty soon. Some of our providers are trainers. And then because I'm lucky, I have like the most advanced advanced injectors. It's fantastic because that's the biggest thing for me. You know, with all of these med spas popping up everywhere, I think people need to understand that they need to go to somebody who's educated and knows what they're doing and not at like just a box place that's like just hiring newbies out of school. Like that's a main thing. That's like a huge, thing for me. Cause how do you know as a consumer, who's educated? You don't know the difference. And so it's really important to go to people that have a lot of injectable experience. But so Daxxify is one of the new things. I'll get off my high horse. I do threads for the right person. Threads are the PDO threads that I use. They lift. They're actually a suture, and you just put them in the tissue, and you need to go to somebody who does it all the time, knows the tissue planes. But if you're done appropriately and in the appropriate patient, you can actually lift, the fat pads and lift the skin a little bit. There's a new jawline filler that's coming to market pretty soon that I'm excited about. I love doing facial balancing and profile balancing. So like you said, you do your talks. And then I think filler needs to be done very naturally. Like people shouldn't look at you and be like, oh, like I was sitting there getting my nails done today. I'm not kidding. I was sitting next to this girl and I was like, I almost said to her, I almost was like, what the fuck? I almost was like, girl, do you want your lips to look like that? Like she looked like a blow up doll. And like, I guess there's that aesthetic still, but in general, I think that and I'm really hoping things are trending toward a more natural look of just looking like yourself and emphasizing your positive features and detracting from the ones that aren't as positive, and, going in that direction versus like the blow up doll, vibe.
I personally don't understand. I don't do my lips at all. It's just, I'm not interested. Cause like my whole thing is I just want to look young. But
well, I have lip filler, but you can't tell. I mean, you want to look normal and natural. And like, people always ask me, oh, what do you put in lips? What do you put in cheeks? Da, da, da. And like, literally it depends on the patient who's sitting in my chair, because I do different things for every client, depending on their skin quality, their elasticity, their collagen, the way their muscles are. There's so many things, so many anatomy and physiology things that I look at, even the skeleton, like the bone structure, and like take all of that into consideration. And then I choose a product, and then I choose, what we're going to do. So it really, people ask, oh, what do you put in lips? Well, like 20 different things depending on you.
Do you think that's the biggest mistake people make? Like sometimes less is more?
For sure, less is more. I'm a big advocate of that, but also I think it's proper placement of product and using the proper product and having the proper training. Again, just going to somebody who's really got, time on task. It's like 10,000 hours makes you good at something is what they kind of say. And I would go to somebody with at least like 5 years of experience, hardcore injecting.
What about, like this woman you saw today in the nail salon? What about like housewives or just famous people? Like, who do you think has had just good, you're looking at, you're like, that's good work or good injections and was looking good?
I think Tamra looks great. I think Tamra Judge looks great. Obviously, Tamra Sam looks great because I did it.
Obviously.
No, and she's also a beautiful woman.
She is.
She's gorgeous. Oh my gosh. And gorgeous inside and out. I think there's a lot of people who I think are trending toward not looking ridiculous. I think unfortunately filler and companies, I think, are being a little bit better about getting products into the correct hands and making sure that the wrong injector isn't injecting, product that they shouldn't be, or if they're, not well trained. So, because when it first came out, everybody was just kind of like, oh, I'll put a little bit here. And, then they started doing more studies and, as you see, under eye filler, you're like, oh, maybe I shouldn't have done that there. Or, you learn over the years.
What about like, who do you look at, either Housewives or someone famous, where you're like the opposite, where you're like, maybe not the best?
Oh my God. Somebody sent me a picture of Madonna the other day. What happened? What happened to her?
It's
what
so
happened? Was it a filter or is it really what she looks like? I don't know. Like, obviously I don't know Madonna, never seen her in person, but holy crap. Like, somebody said, and my friend was like, oh, you need to follow her. I was like, why? And I was like, what's going on? And he sent me a picture and I was like, oh my God.
I don't know what's going on personally, but it's funny because my friend and I, we literally almost every day were like, Auntie M needs our help. That Madonna's our queen, of course.
Yes.
I don't know what's going on.
She's amazing, but just I couldn't tell if it was the filter or if it's her face. Cause like, that's the other thing too. Like, and I try not to use the filters, but sometimes they're fun. You're like, oh, I look cute. But then like people like slam me because they're like, hey, you're an injector, so I try not to use them, but I couldn't tell if hers was a filter or actual real too much filler.
So you think Madonna needs to lay off?
Well, I mean, if that wasn't a filter, she needs to rein it in.
I actually can't tell either. I look at it and I'm like, what's going on here? I'm not sure.
Yeah.
Two final questions. One regarding Housewives, one not. But Girls Trip with the third season is here. Have you, like, no one has been called from Dallas? Do you think they'll start?
I know. Working? I don't think they're going to. I mean, I would actually do that show. That I would do, because it's like a week that I could get into. And like, I think I'd have fun on that. I think I'd be great personally. Like, if I was going to do reality TV, I think that might be one of the only things that I would consider, because it's like a lot less time. And I feel like it'd be fun to get to know other girls from other cities. Like, I always have enjoyed that. I have a big network of different housewives from different cities that I really enjoy talking to, because I think I think it's really cool. I think it's a fun sorority type thing. But I mean, I think kind of the writing's on the wall with that. I don't think they're interested in anybody from Dallas. I just think Bravo is like over it with us big time. And I do not know why. But whatever. If they wanted me to do